So welcome everyone. Good morning to you. Sounds like we do have a quorum, and so we'll be getting started in just a moment here. I just wanted to make sure everyone can hear us on audio okay. Let us know if there's any sound issues or video issues, and then we'll go ahead and keep getting started in a moment or two.
You sound really clear.
Audio sounds good to me.
Okay, sounds good. So, and just a reminder, if you're not speaking, please mute so that we don't get a lot of feedback. And then if you'd like to make a comment, if you can digitally raise your hand, then we can recognize you and give you the floor. So we'll go ahead and call the meeting to order and start with some introductions. I'm Dr. John Burley, Medical Director for the EMS Agency, and we'll move to my right.
Teresa Rios, EMS Agency.
Ryan Alexander, Salinas Fire.
Scott Houchin, First Responders.
Steve Brooks, EMS Agency.
Jeff DeAndrea, EMS Agency.
Well, and then
Cole Click Natividad.
Good morning.
Cole Click Natividad. Good morning.
Morning, Jeff. Morning.
Good morning, this is Roxanne Superfed, EMS Agency.
Cassie Caldera, Natividad.
This is Christy Sobleski, Chomp.
Michelle Kolinsky, Chomp.
Nick Greenson, Salinas Valley.
Okay, thank you all. Once again, good morning and welcome to the Medical Advisory Committee meeting. We'll go ahead and start things off with public comment, an opportunity for any member of the public to address the subcommittee for a period not to exceed 3 minutes on any issue not on the subcommittee's agenda. This is an opportunity for us to listen to all communications, but not specifically to take action on comments. So is there anyone who would like to make any public comments? Okay, hearing none, we'll move on to approval of past MAC meeting minutes. You should have a copy of the meeting minutes from September 9th. If you could take a look at those, and when you're ready, if we can get a motion to approve.
Motion to approve.
Scott Houchin is motion to approve. Can I get a second?
Jeff Warner, I'll second.
Thank you. And let's, all in favor?
Aye.
Aye. And any opposed? Okay, so motion carries, meeting minutes are approved, which brings us to EMS recognition and correspondence. There are no specific items under those, which brings us down to old business. And the first item under old business is EMS agency response to COVID. And Jeff DeAndrea has a staff report for us.
All right. The EMS agency continues to monitor and relay information to EMS system stakeholders. So here's a following list of the key actions taken during the COVID-19 declared emergency. The MOAC has received and coordinated more than 1,200 requests for PPE from various healthcare providers in Monterey County. That includes hospitals, long-term facilities, outpatient clinics, and other facilities that rely on the MOAC and its state and county partners for access to no-cost PPE and other safety products. Fire departments, county agencies, correctional institutions, a range of other facilities use the MOAC to access PPE. We've also secured more than 100,000 since the beginning of the pandemic, 100,000 N95s for local agricultural workers, which has been significantly impacted by the epidemic. Although recently things have turned for the better for the ag worker community. Recently, we've been doing a lot of work with health IT, with our information tech people here and EOC logistics to update our resource request form. Maybe if you guys have used it, you've seen some changes. It's just a little easier to use, and the changes we've made have improved our ability to track data and provide accountability. We've also been extending the state's Salesforce software platform to healthcare facilities to streamline the PPE distribution process, and also further again improve accounting. Excuse me. The MOAC has ensured an adequate supply of swabs, testing kits, now including Binax antigen testing systems that will be going out to various clinics and labs throughout the county. That's the Binax antigen testing system is something that we're that the MOAC is supervising the distribution of, similar to as we did with remdesivir. The MOAC, as a function of the EMS agency, has been working with other health department officials to plan and prepare for the eventual deployment of a COVID vaccine, which is a lot of work and which we have no firm date on for deployment. It seems to be pushing back a little bit from the original projections. And recently, as MOAC, I've been participating in Cal OES Office of Homeland Security, a working group to assess the county's various disaster and emergency response plans, and especially with a longer term view and bigger picture of trying to integrate our plans regionally with other OAs, other counties in the region. So that's the ultimate goal, is to provide a more comprehensive regional approach to disasters. And of course, the agency and the MOAC remains to be an effective resource for communication between state and county health officials and for coordination amongst various public and private responders in emergency situations. Okay. Thank you.
Hey, Jeff, question for you.
Yes, sir.
For the state Salesforce software platform,
Yeah.
can that be extended to first responder agencies, or vendors are not consistent?
Yeah. The answer from the state is yes. And right now we are working out, the deployment hasn't been as smooth as anticipated. And right now I've just got it out to hospitals and licensed facilities, to long-term care facilities. And it's been not as smooth as ideal. It's brand new. So before I want to roll it out to first responder agencies, I want to work out the kinks to avoid complications on your end and my end. And but ultimately, yes,
And we can continue to request PPEs at this point too.
You're absolutely, of course, the old link is still available for you guys. And even when you do get Salesforce at some point, you'll still have the option of the old link, it doesn't go away. So you have, extra options. The idea and the big picture is that Salesforce is just going to streamline the whole process. You'll be able to have delivery straight to the station. You don't have to pick things up and all that.
Okay.
But yes is the answer to your question. So,
Thank you.
any other questions?
Thank you, Jeff. Okay, that brings us on to policy revisions, and Steve Brooks has a report for us on that.
Good morning, Steve Brooks, EMS agency staff. We're happy to announce that we'll be releasing for public comment a group of policies and protocols for the next revision cycle. Some of them are new, such as the paramedic preceptor authorization policy that we're moving forward. Most are revisions that have been necessary due to changes in medical practice and other, things like that. We also have policies for review. Most of what you see on the staff report are policies and protocols for review that are related to those that have reached their 3-year review cycle date. And so we're bringing them forward to public comment to see if there's something that we think or the public believes should be changed in those policies and a couple of protocols. The EMS agency at this time is not recommending any changes, but it's time for review. And if our stakeholders have something to see in those that should be adjusted, we're happy to hear about that. And we'll be releasing for public comment next week. So questions?
So the paramedic preceptor authorization policy.
Yes,
Go into effect January 1,
July 1.
July.
Sorry, these are the normal
Okay,
cycle
that's-
for July 1.
Okay.
I hope I didn't misspeak and say January.
No,
Okay.
I wasn't sure. So, okay.
Sure, yeah, this is the regular cycle for July 1. And you'll see at the bottom of the staff report on the second page, there's the basic schedule that we're looking to adhere to with this cycle. So you'll see November 5th, we bring the list to MAC, and then next week on the 10th, we will release for public comment and have public comment, a little shorter this time, but the list is much shorter. And also not have people, thinking about doing policy review over the Christmas holidays. So hopefully that works better for folks. Any other questions?
Thank you, Steve. Hey, do you want to move down to the next item there, or should I just comment on that?
I didn't bring the agenda with me to see what the next item was. Oh, TXA, yes. I can address that briefly, and Dr. Burley may have more since we've created a PowerPoint training tool for our paramedic providers regarding TXA and its use and expectations. Dr. Burley's put together that video. It's available on our website. From all accounts, it's been very well received, but it is also mandatory training that each paramedic will need to verify that they've completed before January 1 at the implementation of use of TXA. And Dr. Burley, do you have anything you'd like to add?
Yeah, just that, this was an effort to provide some education on the website, and we're looking to do similar projects in the future, and so you can look for that down the road. Okay, that brings us next to let's see, policies and protocols to be posted to the EMS agency website around the middle of December. We already kind of touched on that, and then policy and protocol development cycle, which you already mentioned, Steve. And that brings us to new business, and there are no specific items under new business. And nor are there specific reports for the EMS System Quality Improvement Program. Those committees did not meet recently, and so no specific reports there. And that brings us to general reports, EMS agency update from Teresa.
Thank you, Dr. Burley. As stated in the staff report, the EMS agency continues to evolve in response to results of evidence-based research and feedback from our stakeholders. I know the TXA training has already been mentioned, but I think it's worth highlighting that the state approved our application to add TXA to the paramedic local scope of practice in September. And we produced a video, a training video and testing materials. Those, just a quick reminder, they must be completed by all paramedics prior to the January 1st, 2021 effective date. It has been posted on the website, as it has been mentioned, and we do hope that this is the first of more projects in the future. The EMS agency received very positive feedback complimenting Dr. Burley for the excellent job he did with the training video. And it is a very convenient way for individuals to complete training. The EMS agency's goal is to continue our effort to work with our stakeholders to improve the EMS system and continue to adapt to the changes so that together we can meet the needs of our community. I also want to take advantage of this opportunity and welcome Jeff as now a permanent member of the EMS team, and also to announce that we have filled the other 2 EMS analyst positions. They will be starting one in the next couple of weeks, and then one a little later, early December. Also to announce, and I think some of you received already notification that Laura Wallen is out. She'll be back joining us early December. And so we have sent notification and instructions on, any questions that would have been directed to Laura. We have listed an email address, which is a general email address that we all have access to. And for calls, they're right now being answered in our general phone line. We want to make sure that any inquiry, any question, any concern, that it receives the attention that it needs. So we've implemented that to minimize anything falling from through the cracks.
Thank you, Teresa. The next item under reports is emergency communication drill reports, and Jeff DeAndrea has a report for us.
This is a very brief summary. For those that can see the graph there, over a year ago, compliance with the 800 megahertz testing was quite mediocre, let's say, and then this had become an agenda item due to that. And we're happy to announce at this point that things are consistently looking great. As you can see, AMR has been doing great in providing the test to the 4 hospitals, and the numbers have been steadily increasing. And this past couple months, we've seen that for September and October, probably the best, for all 4 hospitals as an aggregate. Although one there may not look too sharp, but on the whole, I think we are being more and more consistent with that this year, and we're happy to announce that. That's about it. Any questions on that? Okay, thank you. Oh, and I should add that the ReadyNet testing system has been down since March due to COVID, and there's really no anticipated time for ReadyNet to be back up. I mean, the system is up, of course, but the testing, the regular daily testing. Thanks.
Thank you, Jeff. And then the next item on the agenda under reports is Apot Times, and Steve Brooks has a report for us.
Hang on a second here. Okay. Regarding Apot Times, you'll notice that there's been an increase over time, and we're continuing to monitor this. We really, are grateful that it's not as bad as in many other areas, it's of the state, and especially of the country with the increase in COVID. Hospitals have changed in their practices for bringing people in. Therefore, we do see some of that impacted on our Apot Times, and it's just going to be a wild ride for a while, especially as we enter flu season. Are there any questions about it that I could answer? Thank you.
Thank you, Steve. The next item is any future agenda items to be brought to the committee? Any suggestions on future agenda items? Okay, and then the next item is announcements. Go to the order. Any member of the committee may make announcements or comments. MAC may not discuss or take action on any item raised during the announcements, except to decide whether to place the matter on a subsequent agenda. Any announcements or comments for good of the order? Yeah, do you want to comment on that?
Well, just to let you know that the 2021 EMS meeting calendar was included with your agenda packets. You will notice that for the room, the location, we do have this room as the location, but that is to be determined. We can't book the rooms for 2021 until December. We usually try to be the first ones in, so to secure this room. And then as we continue with COVID, we'll continue with the meetings being held primarily via Zoom. But we will confirm later as the information is available.
Any other comments for announcements or good of the order? Our next meeting date is scheduled for Wednesday, January 13th, 2021 at 8:30 a.m. And as Teresa just mentioned, information regarding the location will follow. The plan is to have it here, but we will let you know once we have confirmation from the from the powers that be. Okay, well, thank you all. That brings us to adjournment. We'll go ahead and adjourn the meeting. Thank you all for coming and for participating, and please stay safe out there, and we'll see you in January.
Thank you.